A very good morning to you. My name is Olive Burrows and you're watching Your World. I'm sitting in for Winnie Lubembe, and this morning we're looking at maggot debridement therapy. Maggot debridement therapy. And with me in studio I have Mr. Christopher Kibiwot, Wound Care Kenyatta National Hospital. We also have in studio a beneficiary, and her name is Penina Kuria. And I'm going to start with you, Daktari, and please permit me to call you Daktari. Maggots, you know, when I think of maggots, I think of the slimy, you know, they look like pockets of fat insects. What is a maggot for those who may not be familiar?
So when we talk about maggots, many people feel the way you do, but these are specific type of maggots from a specific type of fly, which are medically used to treat chronic wounds, especially the wounds which have a lot of dead tissue, what we call necrotic tissue. Flies,
yeah, the ones you don't want to land on your food, you don't want to land on you because you're like they carry feces.
Actually, it is the flies, the green ones, which people usually associate with those bad places. So those are the flies we are talking about, because they are, we have the house flies, they have maggots, yes, but they don't do as much work as these other flies, the green ones. Yes.
So the ones that you utilize are the green ones?
Are the green ones, which the ones we call Lucilla sericata. That is the scientific name.
Okay.
So we use those ones, but research is going on to look for other species which might do the same. It is happening in KALRO, what we call Kenya Agricultural Research Organization. Yeah.
So do you grow them in a lab?
Yeah, they're usually grown in a lab. We have what we call a colony. The colony which we have in KALRO usually was imported from Czech Republic. And that is the colony we are using up to now.
You had to import it?
Yeah, because they were not available locally. And I'm telling you that's why the researches are still going on to see whether we can get local flies to do the same job. But right now we are using imported flies.
Okay.
But they are the same type of species.
It sounds counterintuitive to me, because we are told that, you know, you have to be careful about, that's why we cover our food and all of that. You have to be careful about these ones because they could cause illness. But now you're telling us they're used, actually, let's first define debridement.
So when we talk about maggot debridement therapy, it's actually the act of removing dead tissues from a wound. To take you back, what usually causes the wound not to heal, in most cases, is accumulation of dead tissue. So long as you have the dead tissue in a wound, there will be no tissue growth, and actually the wound will always expand and even get worse, get infection and all that. And eventually somebody might end up with amputation. So that is, when we talk about debridement, it is removing of the dead tissue. And it can be done surgically, somebody going to theater under anesthesia, then it is removed. And it can also be removed using the biological method. This one is called biological debridement, because we use live maggots to eat the dead tissue and now achieve the same purpose and even more. Because actually when we talk about the maggots, they usually get to places where the surgeon cannot get into. They get deep into the wound, even if it is a cavity going all the way to the knee. They will always get there and get that dead tissue out.
So they don't eat healthy tissue?
They don't. Actually, the enzymes they secrete make sure that they never touch any healthy tissue. Not a single cell of the tissue is touched. Yeah.
All right, so back to my question, which is, it seems counterintuitive because we are taught to think that flies are dirty.
Okay, flies, the normal flies are dirty only because they get into those dirty places and come to our food. But when you talk about the medicinal maggots, they're usually bred in a laboratory. They are never in touch with external environment. So that's the difference.
All right, so they would not cause infection?
They will not cause any infection because they are prepared under very sterile conditions in what we call 4-cage system, whereby it is a long process. But by the time they get to the patient, they are usually sterile maggots.
Okay. So are maggots baby flies?
Yes, they are. You remember, you remember the life cycle of a fly, what we learned in primary. Egg, larva, pupa, adult. So what we utilize is the larva stage. And actually the larva stage is what is known to be the real heavy feeding stage of a fly. After they have fed and they are full, after 24 hours or 48 hours, they turn into pupa. And pupa is that stage where they are in suspended animation. They just look dry. Then after that stage, within another 48 hours, they come out as flies.
All right.
So we only utilize the larva stage. And that is what we call the maggots now.
All right. And I'm curious what you do with them after, once they continue in their development. Right. But first, Penina was laughing when I said baby flies. But Penina, tell me, you're a beneficiary of this therapy. Perhaps you could tell us how this came about, if you're comfortable?
Now, I had a wound. It was a small one. When I went to some hospitals, they were not giving me the proper treatment. So somebody introduced me to Mr. Kibiwot, Dr. Kibiwot, and when I went there, he started treating it because they had said that it can even be cut where I was going. So when I was introduced to Mr. Kibiwot, he started treating me. He told me that after sometimes, he told me that because we don't want you to lose your leg, what we are going to do, we are going either to do surgery or we introduce the maggot. I started feeling so bad because I know what a maggot is. Something on my body. Because I thought when it will be put, it will start eating me or I get itching. But now he told me how it goes about. He gave me a lesson. So after that, I said, no, give me time to think. Now, after thinking for a long time, that's now when I agreed. And they were introduced. When they were introduced, my leg started changing. I was walking on a crutch before. But from then, I started walking on my own, although I was limping a bit. And now, I'm okay.
So how, if you don't mind me asking, how did you get the wound?
It was just a small pimple. I don't know where it came from. But after getting lessons with Dr. Kibiwot, he told me that the problem was the circulation of the blood.
Oh, okay.
There was a problem in the circulation of the blood. That's why I got the pimple. But where I went to the hospital, they started now interfering with that pimple. And it became a very big wound. Because they were treating it with some chemicals, I don't know. It became so big. So when maggot were introduced on me, I did not even feel anything. They were just there, they were tired. But I was told when they were put there, whoever we were with in the hospital, they were very tiny. But after staying for some time, they became big because they are feeding on the dead tissue. But I was not feeling anything. I was not feeling anything. I could even sleep from the whole night. But before I was not even sleeping. I was staying awake.
Because of the pain and the discomfort. So, you know, it's interesting that you said they were tight because I was like, well, you know, when they were being put, were you like this?
No, I did not even see. I just put my leg there. I looked at on the other side, so they were introduced. He covered, he put everything, and it was tied, just like a normal bandage. So I had to stay with it for 48 hours. Then when I came to be removed, whoever was with me told me that they were so big. Yeah. So I didn't look at them.
So you didn't even look when they were removed?
No.
Did they take pictures?
I don't know.
I saw some pictures and they're not for the faint of heart. So that's a really good outcome. So it transformed.
It transformed,
your
yes.
fortune.
Yes.
Especially when you're told you risk losing a limb. I'm sure that was terrifying.
And from then, I did not take any medicine. But before, I was given some antibiotics, other medicines, and it was not improving. It was worsening. But from then, I didn't take even a Panadol. I was okay. It was not painful. It was not... I was not
you didn't feel like slimy?
No,
moving?
I didn't feel anything. But I thought, in the beginning, I thought they were going to eat. I'll feel them eating me.
Yes.
But there is nothing. They were quiet. The place was cool.
So you stayed with it for 48 hours?
48 hours.
Ah, okay.
Then from then, it was removed.
So after, so you're not, like, you can't get up and do your shower, you do like a sponge bath and all of that?
Yeah, that is it.
Oh, okay. Doctor, tell us, how did you get into this sort of therapy?
Okay, the history is a bit funny because it happened when some people from Cairo visited Czech Republic. Then they realized that, because, you know, they deal with insects also. It's what the department called entomology. So some had gone there. Then in Czech Republic, they realized that maggots were being used to treat wounds. And they were sure that they can be able to rear that kind of flies. When they came back, they consulted us. I was in wound care at that time. That is 2013, with Dr. Wanjiri, who retired. Then they approached us. We saw this and this in Czech Republic. Can we do it in Kenya to benefit the patients? Yeah, then we looked at it. We had read about it anyway long ago in school, but it was just something which was not being thought about so much.
It was theory.
It was just theory. Then I and Dr. Wanjiri said, okay, why don't we try? So we did what we call proof of concept in Kenyatta National Hospital, where we applied a few patients and observed what could happen. And actually there was dramatic changes in their wounds. The patients who could have stayed for 3 months were able to stay for a few weeks and go home, or go to the next stage, which could be maybe skin grafting and the rest. And then that is when we got the go-ahead to use the maggot therapy to treat such wounds. So that is how it started in Kenya. That was 2013. So it is now 10 years old. But I must say that it is a common practice in America, Europe, and the country which does it in Africa, which I know of, is South Africa. Yeah.
Okay. You know, the maggots I have seen usually is in I watch a lot of these, you know, these crime investigative dramas, and they'll be like, the lifespan of the maggot can determine time of death. And I remember I watched one particular episode of CSI Las Vegas, and a woman had a head injury, and the maggots, it was said, that actually what kept the wound clean, and it really surprised me. And then I think Bones, there's that series called Bones, and the maggots were used to, because, you know, they need to get to the bone to do all those anthropological things. They used maggots to eat the dead tissue. So, like, for me, it really feels out of this world. Did it feel the same way for you when you first tried it? This was in 2013?
2013. Okay, being in a medical field, having been there for many years, it did not feel out of place, because actually in the medical field, we always look for cheaper solutions for the clients. We don't want clients to be going through a lot of cost and all that. When we realized that it could reduce the cost, we just went for it. With the support from Kenyatta National Hospital, we were able to do it. So
tell me about the proof of concept. This was the first time you tried it.
Yes, proof of concept is you just, you have a concept which is being used elsewhere. You just want to see whether it can produce the same results locally. So did you bring in doctors from the Czech Republic, or? No.
Did you,
What we just got was the colony of the maggots.
Okay.
And of course, there were a few people who are trained in Czech Republic on how to handle maggot therapy, especially when it comes to preparation, the breeding, because that is where the most important task is, to make sure that they remain sterile. So that was the preparation.
Interesting. Why is it important that they remain sterile?
They have to remain sterile because, you know, you are introducing the maggots into somebody's wound. So we want them to remain as sterile as possible. Yeah, we don't want any external contamination, which can introduce other infections and all that.
Okay. Yeah. And you didn't, when you apply them, and you'll explain how you apply them, you don't feel in the
No. See, I'm telling you, in the medical field, we see a lot. We see a lot more than the maggots, actually. So that wasn't anything that could make me feel off. Yeah.
All right.
Yes.
So, Penina, you went and thought about it, and because you said you knew what maggots were. But given the dire situation that you've been told that either it's removed surgically or the wound is cleaned using maggots, why didn't you opt for the surgical option?
Surgical would take a lot of time. When I was educated, I saw that surgery will take a long time, but this one did not take long, as I was explained. So I had to wait and see how long, because I was told it is only 48 hours, we remove it, and the wound will start healing, and it was true. From there, it had stayed for 6 months. Then after the maggot, it was less than 4 months.
The wound healed on its own.
Started healing on itself without any medicine, only cleaning it and bandaging it.
Yeah, because I was curious about the aftercare. Do you take the maggots home with you to reapply?
No, you just apply once. The doctor apply once. Then you go home. After 48 hours, you come back. I was not even admitted. After 48 hours, you come back. Then he will remove them. After removing, it is only
so
cleaning.
You were not even admitted?
No.
Okay.
After 48 hours, even mine was less. Mine was less than 48 hours. So when I came back, he removed it, used water, ordinary water, and soap, clean the place, put a bandage for protection. No medicine, no
antibiotics. I remember you said no antibiotics.
I was not even taking anything.
All right. So we need to take a break. But when we come back, I'll ask Dr. here, how do you know the maggots have done their work? Does the flesh now become a nice, healthy pink or something? All of that on the other side of this break.
As a mother, I have to do my duties in the house. It forces me to send her to the river because I have no alternative.
Pia ora ok ber, ler bedo ok ler. Otuo nikech pia ora. Otuo ok odhi skul, japuonj chunye chandore.
If children had water close by, they won't be sick, they won't be distracted because the water is clean.
Are you a Kenyan youth ready to unlock your true potential? Join us on the 14th and 15th of July 2023 at the University of Nairobi for the Skill Up Africa 2023 as we mark World Youth Skills Day and get the chance to gain insight on the skills that will shape your future and unlock your potential. Register now for free entry at kenyabuzz.com or call 0724 661 440 to explore 2 days of transformative experiences, empowering dialogues, and invaluable networking opportunities. Skill Up Africa 2023, unlocking the potential of Kenyan youth through skills development.
I invite you to walk with me for a minute in the shoes of a girl who is on her menses and has no access to sanitary products. Imagine what it's like for her to sit in class, more concerned with staunching the flow than what her teacher has to say. Imagine her sitting back as she's afraid to get up and stand up before others leave the room for fear that she may have stained herself. She stands up, she wraps a sweater around her waist, perhaps a scarf, and that is only the visible. Imagine the smell that may emanate from any infections she may get from using unsanitary products. That is the cost of not talking about ending period shame and period poverty. We can no longer have these conversations behind closed doors in hushed tones. We must speak up and change the cycle.
You are watching Your World in association with Colgate.
Welcome back to Your World. This morning I'm learning about maggot debridement therapy. Maggots, the larva stage of the green fly, is used to eat dead tissue to allow wounds to heal. Does it work only for specific types of wounds?
No, it's not specific type of wounds, so long as it's a wound which has dead tissue. The causes might be different. It could be due to arteriovenous insufficiency. That is when the blood vessels are not able to return blood from the lower limbs. Mostly it affects the lower limbs. It could be because of diabetes. There are people who are living with diabetes, and actually they are prone to a lot of wounds. So that one is still can fit the maggot debridement therapy. It could be as a result of road traffic accidents where there is massive dead tissue and the patient may not qualify for surgery because of one reason or another. Somebody might not qualify for surgery because of one, they have very low HB, the blood, they have lost a lot of blood. They have other complications which can rule them out of going to theater. So maggot therapy can work under all circumstances. So there is no specific type of wound, so long as there is a lot of dead tissue. Even the cancerous wounds, actually most cancerous wounds come with a lot of necrotic tissue, the dead tissue. So we try as much as possible, we put maggots there, they feed on the massive dead tissue, and the patient can have a near normal life. The quality of life changes because they usually live with a lot of bad smell, they live with a lot of pain. So when we introduce maggots, they actually make their life a bit easier. That's how it can actually help alleviate the pain and the suffering from the cancerous patients.
You're telling me you've dealt with patients who've lived with wounds for up to 18 years?
Yeah, up to, actually the one I can remember whom we treated very well was a man who had stayed with wounds for 18 years. And the wound was actually massive, covering all the way from the ankle joint to the knee joint.
What was the cause?
The cause is the same, arteriovenous insufficiency. But this one had arteriovenous insufficiency because of diabetes. He's a diabetic fellow. And he's a man who was, actually, that was among our first patients in around 2014. And he's a living testimony. Up to now, he's okay.
So is this therapy only available at the Kenyatta National Hospital?
It's available in Kenyatta National Hospital, but also in other hospitals. We have done some training in other hospitals around the country, but mostly concentrated in this region. We have done in Nyeri, and because we have trained a few medical practitioners over the last 1 year, Kenyatta National Hospital has been doing a lot of training on wound care. So we are hoping that those ambassadors will now go to the regions and initiate maggot debridement therapy. Actually, I've had a few guys who have requested for maggots as far away as Homa Bay, Kisumu, and some areas of Machakos and all that. So we are hoping that with time, it will be available across the country. Yes.
All right. Penina, I'm curious, what are some of the things you tried before eventually finding your way, or rather, What are some of the things that were prescribed before finally being told about the maggot debridement therapy at the Kenyatta National Hospital? It was a referral, I assume.
It was, no, somebody referred me to him, to the doctor.
It was not the hospital. It was not the hospital.
It was not the hospital. Yeah.
So when you were going to hospital, I'm sure you went a number of times. What was being prescribed?
That they were just giving me antibiotics, cleaning the wound with this we called hydrogen peroxide. They were cleaning, they were injecting now the body. So, and I was prescribed many types of medicine. Yeah. And they were not doing good to me. They were becoming worse.
Okay. And you know, when you met people, because you're saying you were walking with crutches, so obviously people can tell there's something wrong. You know, did just the ordinary, like the everyday person you meet, did they also have prescriptions for you?
The who? The doctor or the
No,
the
just people you
the
met.
Ordinary people,
Yeah.
yes. Yeah, some were telling me to try aloe vera. Some were telling me this should be taken somewhere. It's not, this is not godly. So I can look for those people who are outside there, like witchcraft, something like that. But I have a hard heart. I did not agree. We go somewhere, you be prayed for. I refused. Yeah, many things, many.
Because I was sharing with Penina that I struggle with acne, and I've tried all, because I was really, at a certain point, it was so bad, I was trying anything and everything people told me. Wash your face with vinegar, niliosha. You know, so Dr. What are some of the stranger things you have had?
I have had a lot of stranger things. Dealing with my patients, I have had many people being told to go and wash their wounds with this mafuta ya bunduki. I think there's some oil which they use to clean
the guns,
which are corrosive. I've had people being told use cow dung, use hash, use hydrogen peroxide, which is actually not recommended at all. We don't recommend hydrogen peroxide on any kind of a wound because...
Really?
Yes. Because it kills the cells. Hydrogen peroxide, or what we call betadine, and that is what is being used very commonly in most of our
betadine is on the purple?
Yeah, the purple one. And that is betadine. Actually, when you go to any chemist with a small wound, you are likely to be told, this is a drug for you, but it's not. It kills the cells which are trying to grow. It does not promote any healing of the cells. Hydrogen peroxide is another one. I even wonder why people are still keeping it in the hospitals. That one should not be used at all. I've had stranger things from my patients. Some being told, oh, this one, like what Penina is saying, this is just witchcraft, so you have to go somewhere. I've had another one who was told to go to Mount Kenya and get fresh ice from the mountain and apply on the wound. Of course, it got worse.
Really?
Yeah. There
Wait,
are a lot of
seriously?
yes.
Fresh ice from?
Fresh ice from Mount Kenya. Actually, the guy went there at 3 a.m. to Mount Kenya, got some boys to go up there and get
fresh ice.
Fresh ice, and he put it in a freezer so that he was told to be applying every day. And by the way, it just got worse because a wound usually needs good body temperature. It does not need any low temperature.
Extreme or low temperatures. Okay.
Yes, at all, not low temperature at all. So I've had a lot of stories about how people are being told to do 1, 2, 3. What I advise them always is listen to the healthcare worker, because actually that is the nearest way to find a solution, not to hear from outside there. I did this and mine got healed. It might have been just a small cut and you used betadine. So it got healed not because you used betadine, it's because it was just on its way healing, because it was just a small cut. Yes.
So, because I'm assuming the reason people use betadine, use hydrogen peroxide is to keep the wound sterile.
You might want to keep the wound sterile, but you are killing the cells. So what are you doing? Because by the way, in wound care, you assist the body to heal itself. You don't do any miracles. You just remove the dead tissue, you remove any inflammation, you remove any infection, and let the body do the work of healing. So when you apply hydrogen peroxide, you apply betadine, you are actually derailing the process
Of healing.
Of healing. So you are making that patient, instead of healing in 3 days, they will heal in 1 month. So that one, you are not doing justice to that patient.
Okay.
Yes.
So I'm curious, what then do you recommend for wound care? And does it depend on the extent?
Yes, the wound care, usually you have to make a diagnosis of that kind of a wound. But always, when it comes to cleansing the wound or cleaning that wound, always use, if you don't have sterile water, use normal saline, which is also assured to be sterile. Don't use anything else. Don't use any chemical for cleansing.
So then, saline is mixing water and salt?
They are available in the market.
Oh, okay.
They are called normal saline.
So you purchase it?
You just purchase it. It is less than 70 shillings. Yeah, you can use that one to clean the wound and then cover it appropriately. You don't need to use any chemical on a wound. And as I said, we try to assist the body to heal itself. We don't try to put chemicals that we are trying to treat it. I have seen people even using spirit on a wound. That one is also wrong. It is corrosive to the tissues. Yeah.
So, okay, so either clean water
or normal saline.
Or saline.
Or sterile water. In fact, if you don't have anything, you use normal tap water. That will be still okay.
Really?
Yeah.
Just water?
But just keep off from the chemicals.
Water and soap or just water?
Just water. Don't add, soap is a chemical, so we don't need to add anything else there.
Ah, okay.
But of course, when you go to a practitioner, they will always use anything sterile.
Okay, and then you cover the wound?
Now you cover the wound, and when it comes to management of a wound, as I said, there is a diagnosis of each and every wound. It could be a wound because of burns, a wound because of road traffic accident, a wound because of cancer, a wound because of diabetes. So when you make a diagnosis, you have to decide, what do I do? Because if it has necrotic tissue, there are two ways. Use surgery or use maggots. If there is infection, we always try to use topical antibiotics. Topical antibiotics are just the normal dressing materials. People know about the Bactigras or the one that looks like a net. That is still a primary dressing. But the other which are really good in the market. So when you make a diagnosis of a wound, it will tell you what to do next. Yes. So
first seek healthcare.
Healthcare, yes.
Then, because no, what is wound care now aspect after you have already been diagnosed, and so do you usually have to take antibiotics?
Antibiotics are not necessary in wound care, by the way. They're only necessary if you take, if you realize that there could be what we call systemic infection. Maybe one way or another, there is a bacteria which has gotten into the bloodstream, and that one we always take blood culture, and then we decide whether we need to use an antibiotic or not. But mainly, no. We just treat, because infection on a wound are usually local. Yeah, so we just treat it locally. That's why you heard Penina saying that she has used a lot of antibiotics, because many practitioners out there, many doctors, many clinical officers, always equate a wound with antibiotics. When you go anywhere, they will just not even look at the wound. You tell them, I have a wound somewhere, they will always give you an antibiotic. Treating what? Yet it is a local infection. So deal with the wound itself. Yes.
Okay. And in Penina's case, it was 48 hours. She went home, she was not admitted. Is that the standard of care?
Yeah, that is the standard of care for maggots. Because I told you earlier, we are following the life cycle of the fly. So they just need to feed for 48 hours, and they are fed. They just want to go to the next stage. They don't want to remain in that wound. Yes.
Okay.
As soon as they are full, they just want to get out of that place to get to the stage of pupa. So in our case, when we remove the maggots, we don't allow them to continue with the circulation. We just we euthanize them. We just suffocate them. They die peacefully. Because if we leave them, they will just be flies all over again. So they have done a good job, but we just have to let them go.
So, but do you have, a Calro, I'm assuming, has breeders?
Yes.
Okay.
Calro has technicians who have been trained on how to breed maggots. and they do, it is a process usually. So what usually happens typically, when I have a wound like that one of Penina, I make a call that I have a wound this size and that size. And we usually have a calculation. It is 4 maggots per 1 centimeter squared. So if a wound is 10 centimeters squared, we know how much we want. If you have diagnosed the wound and it is deeper, we usually double the dose so that they eat well. And we always say we add a bit more. It's always better to have more maggots than less, because we always don't want to repeat the therapy. We just want the therapy to be one-off. Then after that, the Caldro guys will deliver the maggots the following day. Then from there, it is our clinical work now to apply and then remove.
Okay.
Yes.
I'm curious, Penina's wound, it was around your knee?
No, yeah.
Around your ankle?
Okay. From here, this part.
Okay. The back of the leg?
The back and here, like that.
Oh, okay. So, in her case, 48 hours.
48
the
hours.
guy who had a wound for 18 years, you said from the ankle to the?
To the knee.
To the knee.
Yes.
Was it the same? Because you talked about this is sort of therapy you want to have one-off.
Yeah, it was, for her, the dose was a bit high because the wound was also very big. And we did a one-off. We just applied about 4,500 maggots. And after 48 hours, the dead tissue was gone.
This is for the 18 years?
For the 18 years, the one who had stayed with it for 18 years. Then fortunately, there was good granulation and the skin was able to come back over time. Actually, it took us about 6 weeks and the skin covered where the wound was and the man was able to be okay.
The skin, it sort of regenerated?
Yeah, so it's just what I told you before. We have to assist the body to heal itself. Once you remove the dead tissue, by the way, the skin becomes very aggressive in trying to cover itself. Yeah, that is what it does. In some cases, the skin might take longer, especially with patients with diabetes or other complications. So in this case, we recommend skin grafting. So when we do skin grafting after maggot therapy, it holds very well. It does not take a lot of time.
So skin grafting is taking skin from somewhere else?
From somewhere else.
Is that creating another wound?
No, it's actually the way we harvest the graft is it's in such a way that it is like a mesh form, whereby one bit is left on the primary site of the knee and the other one is removed, which comes and covers the wound. So usually what we call the donor site heals within 6 days. But the grafted site might take maybe about 2 weeks or so. So actually it's not a matter of creating another wound. But of course, there are some other underlying comorbidities, like somebody with diabetes. That area we harvested the skin from might also become another wound. So those are the risks we usually try to assess. Yes.
You can't grow skin in a
lab?
Yes.
That one has not happened yet, but I'm sure research is going on elsewhere, but we cannot grow skin. We usually use what we call autograft, your own skin, because we cannot use a skin from somebody else.
And there's no synthetic material that could...
They are in the market, but they are not available locally. If they are available, maybe with special orders. And in my experience, they don't work like the patient's own skin. Yeah.
Okay. But are there wounds for which this type of therapy would not work?
Yes. There are wounds, especially the penetrating abdominal wounds. We don't use maggot debridement therapy for simple reason that we don't know the extent of that wound inside. And we have not had conclusive studies to show that it is safe to allow maggots to get into the abdominal organs. So those are the limitations. Another limitation is those people with what we call pressure sores, bed sores all over the body, for the simple reason that if we don't treat what caused the wounds in the first place, even the maggots will not work. It will clean the wound for that time, but so long as the patient keeps lying on the back or on the side where the wound is, it will produce very little result. And that happens also in surgical debridement. You remove the dead tissue, and after 1 week, we are back again to where we started. So we have to treat the underlying condition. If the patient is bedridden because of stroke or something like that, we have to look for other interventions, like having ripple mattress, having what we call airing. Yeah. So that the only difficulty is that you will have to keep repeating maggot therapy. And then there is another risk that when you put the maggots, especially on the back, and the patient is lying on the back, you will suffocate the maggots before they finish the job.
So did you, Penina, first of all, how did this having the maggots on your leg, you know, when he was sending you home, did he tell you, okay, don't do this and don't do that, you know? And also, how expensive was it?
It was not very expensive, but he didn't tell me not to do anything. He just left me like that. Only that, make your legs stand straight, don't bend it. Because it was starting to bend like this. If tissues grow this way, it will not come back again because already I'm old. The knee cannot come back quickly. So I was just told to go home, and that night I slept so well. Yeah, than never before.
Okay, so just don't.
I continued with
bend.
whatever I was doing.
So he told you just don't bend the leg. Okay.
So we usually give the patients very clear instructions, and it's always important to explain to the patient about the procedure from the beginning to the end. So in most cases, we tell them to expect more discharge than normal because these maggots usually achieve debridement by using enzymes. They produce enzymes, which comes with a lot of fluid. And they have so many enzymes, by the way. Most of they kill bacteria. They digest the dead tissue before they take it in.
Zikona meno?
It's got a very tiny meno, but they usually use the enzymes. So they just secrete it is what we call extracorporeal digestion. So they secrete the enzyme which digests the dead tissue. Then after digesting the enzymes digesting the dead tissue, it becomes like liquid. Then that is what they ingest. So that is how actually they achieve.
Oh, so it's not like they're sinking their teeth into the flesh.
No, they don't sink it. They don't use teeth. That is what we should know. They don't use teeth. They just use enzymes. So that is why we explain to the patient that when you go home, after 24 hours, you will experience more exudate or more fluid than normal. So they are just working. It is the maggots working, putting in a lot of enzymes to digest the dead tissue so that they can be able to ingest.
Okay.
And let me mention that the maggots actually help wound healing in 3 ways. One of them is digesting that dead tissue and ingesting. Number 2, the enzyme kills bacteria. Actually, they are very strong antibiotics which kill the locally available bacteria. Number 3, that wriggling movement really encourages the tissues to grow. And you should be able to note that as soon as you remove the maggots, you will see very happy tissues which have grown overnight. Yeah. So in fact, we think there is some beneficial enzymes which help in regenerating the tissues. So that is how the maggots work.
And this maggot has zikwamili?
Zikwamili, because I told you the cycle. When you talk about the cycle, no maggot wants to remain inside. Actually, by the time we remove them after 48 hours, you will find all of them stuck to the gauze. They just want to get out and move to the next stage. So there is none which can remain inside.
Okay.
They just all come out.
And how expensive is this therapy?
The Calro guys sell maggots at 4,000 per dose. And when we talk about the dose, it doesn't matter. If it is 10,000 or 500, it is a dose. So it is just 4,000, and that is it.
So for that one-time therapy, and for the 48 hours?
For the 48 hours, it is 4,000. And of course, many hospitals can charge their own fees. The doctor can charge their own fee, but the purchase price is 4,000. Now, if the maggots are going far from Nairobi, the transport cost must be factored in. Yes.
And how do you transport them so that they don't, because if the maggots are coming from Nairobi, Calro, going to Marsabit, for instance,
yes.
How do you keep them from turning into pupa?
They don't turn into pupa because they have not fed.
Oh, okay.
And when we put them in cold boxes, they can actually stay for more than 48 hours. So in 48 hours, there is no part in this country you can't reach, even if you use the public service. Yes.
Okay.
Yeah.
And so when you're sending somebody home, and you don't need to be admitted for this therapy.
You don't need to be admitted.
What do you tell them? Like when you're sending Penina home?
You just give them the instructions to expect more than normal
discharge.
Maybe after 24 hours to expect maybe some movement if they have that feeling. And then you just tell them to make sure that they don't crush the maggots, depending on where the wound is. So that is the instruction.
All right. Penina, for those who are watching this, they're dealing with a wound, what would you say to them on this maggot therapy if they're not completely sold on the idea?
I would say that it is the best, and it takes a shorter time than the treatment, the ordinary treatment. Because you see, I had gone for 6 months, and this one was less than, till the head, from maggot to the head, it was less than 4 months.
Okay. So nothing to fear?
Nothing to fear.
Okay. Nothing has ever grown there?
There's
flies
nothing.
Coming out?
No, it's just a skin and the scar. Where there was a scar, it is still there. But it has healed. Even if you touch, I don't feel anything.
Okay. And Daktari, has this therapy ever backfired?
Okay, the only backfiring I've seen is when the patient feels fearful and they ask me to come and remove them after 6 hours. That is how it can backfire. Because even after explaining to the patient what to expect, I think psychologically there is somebody who feels, hey, I have some strange things in my wound. So after 6 hours they are calling you, Daktari, just come and remove them, I can't sleep. So that is how it backfires. So that's what we usually, to mitigate that, we usually make sure that we put a larger number, so that even if the patient complains within 10 hours and you go and remove, they have already done the job, because there are many. Yes.
All right.
So that is how sometimes it can backfire.
All right.
Then what I must mention also is it is a cheaper method compared to going through the ordinary. It takes shorter time for the wound to heal completely, and it is biological, meaning there is no side effect, and because it acts locally.
All right. Thank you very much. I will let that be the last word on the subject. But this morning, I have had in studio, he's insisting I call him Mr. but he's a doctor, Mr. Christopher Kibiwot, Wound Care, Kenyatta National Hospital. Thank you so much for being here. And Penina, she's a beneficiary, Penina Kuria, of this maggot debridement therapy. Thank you so much for sharing your experience. And I hope I have learned a lot. I hope what you've heard this morning has been of benefit to you, especially when it comes to wound care. That's it for your world. My name is Olive Barros.
Your World, in association